You need to have co-creation. You can't have academia and research happening in a vacuum separate. We really need to have everyone sitting at the table together, working as equal partners if we want to bring science to have an impact on disease outbreaks.
Welcome to When Science Finds a Way, a podcast about the science changing the world. I'm Alisha Wainwright. And on this series, I'm talking to the global experts who are making a difference, as well as the people who have inspired and contributed to their work. Dealing with outbreaks of infectious diseases is not easy. By the time we know an outbreak of something like, say, dengue or Zika is happening, we're already playing catch-up. The diseases are spreading rapidly, and options to contain that spread are limited. But what if we knew in advance that an outbreak was going to happen? Could there be clues in weather patterns, movement of people, or climatic changes? Clues that could help predict when and where outbreaks are most likely. This isn't just a what if. In today's episode, you're going to hear how early warning systems for infectious diseases are already a reality, and how researchers and policymakers around the world are working together to make them as effective and useful as possible. Joining me to talk about this is Dr. Anna Stewart Ibarra. Anna is, in her own words, an international civil servant and the executive director of the Inter-American Institute for Global Change Research in Panama. But earlier in her career, she was a scientist, and she helped build a model to try and predict dengue outbreaks in Ecuador. Anna's here to discuss the potential of early warning systems, as well as the important work of translating those systems into tools that can be used around the world. Anna, welcome to the show.
Thank you. It's great to be here with you.
So you've worked across numerous disease outbreaks. Why is it so hard to deal with an outbreak once it's already happening?
Disease outbreaks are tricky. And the scientists will always say, we told you so, we told you so. And then the government officials, ministries of health are always scrambling to kind of put out the next fire and to catch up with the next issue. And so there's this tendency to always be reactive. And this is true not just in the public health sector, but with government agencies dealing with all sorts of crises. And so when a disease outbreak is detected, usually we're sort of well into the outbreak because many cases probably had already occurred, were spreading in the community, were not being detected, by the public health surveillance system. And at that point, by the time you detect the outbreak, usually, there's like a wildfire that's burning through the community, and there's many cases that are being spread. And so then it's harder to play catch up, right? Because to do certain things like to order diagnostic supplies for laboratories that need to test for dengue takes time. In some places, it may take weeks or months, to mobilize and get those resources. You may need to train your physicians and your nurses or your frontline medical workers. That takes time. You need to train and mobilize your communities too, your community leaders. And so all of this you're trying to put in place while the wildfire is already burning. Mm-hmm.
So when we talk about early warning systems, what are we talking about?
So early warning systems include mathematical models that bring together different kinds of data from epidemiological, meaning cases, disease cases, counts of a disease outbreak, with information like the weather, rainfall patterns, temperature patterns, also with information perhaps on human movement, on local social conditions that expose people to the disease. So the mathematical model first brings all of this together to make a prediction, to say, for example, given the rainfall over the last 3 months, we're expecting disease, this level of disease, moderate, high disease risk over the next few months. And we could also bring into that weather forecast or climate forecast to say, well, it's likely that there'll be more rainfall in the next 3 months. And so therefore, we know it's likely there'll be more outbreaks or more cases of such and such a disease. So that's the modeling component. But the system, an early warning system, is more than the modeling component. The early warning system itself has to bring in to play the different actors who would respond to the system, who would interpret the information. There has to be some sort of platform, like some sort of computing platform where the model is hosted or where it lives. Maybe it's the Ministry of Health website or some other government agency that then receives the alerts when they come out. And then there has to be an early action plan. So a whole series of actions that occur when they receive the alerts. So when you look at it in totality, that's what I would understand as the early warning system. And if you think about just the model, then that's one piece, that's one tool within the system.
When I think about an early warning system, my initial thought is to kind of compare it to something, here in Los Angeles, we have wildfires. I'm from Florida, like hurricanes kind of. Is it fair to make that sort of comparison when we're thinking about the way maybe it's designed to dispense information about an incoming hurricane? Can I make that comparison to, say, an early warning system for yellow fever?
Yeah, I mean, there are early warning systems for all kinds of natural hazards. Actually, right now, the UN put out a mandate that the whole world should be covered by early warning systems. It's called the Early Warning Systems for All initiative by 2027. Most of that doesn't focus on diseases. This focuses on other sorts of natural hazards, be it hurricanes, drought, flood. So any sort of system that, again, brings in information, for example, weather information or natural hazard information in this case, and other data, to then make a prediction so that then the people on the ground are able to take action, early action, before the event occurs. That's an early warning system. If you're observing the event in real time, for example, there are systems that maybe are using satellite imagery to observe wildfire. That's not necessarily an early warning system, but it still allows for early action.
Say in a perfect world, there is a system that the government is using in tandem with extensive research to be able to get this information out to the community. What does that look like? Is it a text from the government? Is it an app that I would have? And what might I do in response to receiving information like that from my local government?
So I think going back to your example before about wildfires is a good example that you would think about, that there would be a stoplight, often a stoplight sort of scenario where maybe you have low, medium, and high risk. And the citizens would have to receive that, like you said, either through an SMS text message, which has been used, for example, in the Caribbean with farmers when they were developing early warning systems related to drought. And the farmers could receive a text message with an alert. But then you also need to have concrete actions. You have to have steps about what do I do? So there has to be a recommendation. When you receive the alert, just having the alert alone is not enough. Another option may be a website. You may be hosted on the website of the national, public health sector, or there are lots of ways that we already receive alerts about health information. Some places around the world, you see alerts about levels of UV, levels of air pollution, air contamination. It would be very similar. So the messaging and how the information gets out there is really context specific. It depends on sort of how the communities are used to getting information. Some places radio may be, best. If you're working in a remote area of the Amazon, radio may be the best way to reach people. But these days, most people have cell phones in hand. So cell phones-based technology is really important. And again, having concrete, actionable steps that people can take when they receive the alert is critical. For example, with dengue, it could be, checking for containers around the house that could be mosquito breeding sites. They should also know about the symptoms. Like, people should know what dengue fever symptoms look like. So if you see someone in your house that has a high fever and rash and this combination of symptoms, please see your local public health clinic as soon as possible. Getting people to seek medical care is really important.
Let's hear from a community that could use an early warning system for infectious disease. This is Bárbara Priscila dos Santos Corrêa. She's the administrative director of the Department of Health Surveillance in Corrêa in Brazil. Corrêa is a microcosm of different landscapes found in the Amazon region, with rural communities, urban areas, and people living by rivers. But it is also a place where diseases are endemic, which is to say outbreaks of diseases like dengue and malaria regularly occur there. Bárbara spoke about how deforestation and changing climates have affected the incidence of dengue in the region.
I was born and raised right here in Corrêa. I spent some time away studying, but then I came back. And something that's become really clear to me from living and working here is that the climate in Corrêa is getting drier and drier. We're not getting as much rain and our rivers are getting shallower. You can really see a lot of silting in parts of the river that used to be deep. We're also seeing less produce from small family farms. It's harder these days to take care of the land. And we're also seeing lots of deforested areas and a lot of families living around these cleared areas too. These families are really likely to get sick, especially from vector-based diseases, You know, like the mosquito that carries malaria or dengue, or the insect that carries Chagas disease. Even animals that spread diseases like rats and bats. We're seeing these animals, which used to be way out in the forest, getting closer and closer to our towns and our rural living areas, whether it's the riverside communities, or as we call them here, the colonias communities out in the woods, which include the quilombolas settlements as well as other small isolated rural communities. I think these new technologies are going to help us really see the bigger picture of the problem. Because right now, we mostly see things like, oh, in my area, it's like this, and in the other area, it's like that. Having a general, broader view will help us share successful health initiatives from one place to another. It'll give us an overview so we can create a health map that's more effective.
Bárbara spoke about a range of climate and environmental changes affecting Cometa. Even things like animals moving closer to towns, which can lead to the diseases they carry spilling over into the human population. How do all these different factors impact the incidence of infectious disease?
Yeah, what Bárbara mentioned is critical because she's talking about changes in the forest around them, which is changing how people are exposed to different kinds of mosquitoes that carry viruses and other diseases. It may be changing how people are exposed to different animals that are carrying diseases. So as people are moving their settlements into forested areas that were previously untouched, for example, in the Amazon region, then you're more likely to see spillover or emergence, new diseases coming into human populations. So deforestation is a really important variable environmental factor that has to be monitored and comes into play into these early warning systems. But then she talked about other things related to water cycles, weather cycles, and climate. This is critical because most of these diseases, like mosquito-borne diseases in this case, are directly affected by weather conditions,
right,
or water that's supplied, because mosquitoes require some kind of standing water to reproduce and to replicate. And the virus itself is also directly affected by the ambient air temperature. So we know that as air temperatures increase up to a certain optimal temperature range, then the replication of the virus, the speed at which it replicates is faster, which means that the whole disease transmission cycle speeds up when you're within this optimal temperature range. When it's too cold, the disease spreads slower. When it's too hot, it also it'll spread slower.
Taper off.
So that's why having an idea of what that optimal temperature range is really important, monitoring it, modeling it, and predicting it, and also knowing that varies by disease. It's not the same depending on the virus and the mosquito.
What other factors, apart from climate and environment, do you have to account for that can influence when and where an outbreak happens?
In the case of dengue fever, for example, it's really important to know about the history of prior dengue infection. So you have to know something about the baseline immunity of the population. Have people been exposed before to this type of virus? Because if they were exposed recently, then maybe there won't be an outbreak again because you already have a high level of immunity in the population. But if it's been a long time since that same virus came back to the community, then you may have a very explosive outbreak. So having some baseline understanding about people's immunity to the disease is really important. It's also important to know what the public health sector is doing. So if there are medications, treatments, for example, for malaria, or if the community is using bed nets, or if there are campaigns to do different kinds of mosquito control, that will affect, the likelihood
or reducing
of a disease
standing
outbreak.
water or something like that.
Exactly.
Yeah. Okay, that makes sense. Early in your career, you built a predictive model in Ecuador. Can you tell us how that came about?
So in 2007, we began doing research in southern coastal Ecuador in an area that was highly endemic for dengue fever. It means there was lots of explosive dengue outbreaks. And dengue was still an emerging disease because really in Latin America, dengue began to grow from the late 80s onward. So through the 90s, the disease was still growing. There was not much known about how the disease was transmitting, how it was spreading, what was causing the outbreaks, and basic questions about the epidemiology and transmission of the disease. So we began working with the public health sector and with local communities and the National Weather Service to begin to monitor, to do community-based studies, to understand how the disease was spreading, who it was affecting, and when, and if we could say anything to predict it using climate information. So in collaboration with Dr. Rachel Lowe, we developed a first model to understand that El Niño and La Niña events, which are global climate events that are that affect local rainfall and temperature patterns. And these are events that are linked to ocean surface temperatures that then cause changes in rainfall and temperature around the world. So we saw that during El Nino years, we had a greater likelihood of dengue outbreaks. And that was linked to increases in rainfall and increases in minimum temperature. So with this, the work that we were doing with Rachel, we began to understand the historical patterns of disease outbreaks. And then we began to incorporate disease forecasts. So being able to incorporate future projections, future ideas about what would happen with the weather, with El Nino events, to then come up with predictive models of disease outbreaks, so dengue fever in this case. And this was an experiment that we did in 2016 when there was an El Nino event. And we were able to show that successfully we could predict dengue. And we were able to then validate that to go back after the year was done and look at the case and say, yeah, actually the model did a really good job at predicting dengue. That said, because of the political, I would say, situation at the time, the model was never taken up by the public health sector. It was never put into practice. And that was a huge lesson learned, because you may have the best available data, the best available modeling and technology, but if you don't have the political will and sort of the governance processes in place to be able to use the model, then you won't have any impact at the end of the day.
In 2017, you were part of a team that took these ideas and applied them in Barbados. How did you adapt your earlier work in Ecuador to fit this new local context?
Mm-hmm. Yeah, so that was an important step, because the context, again, going to the political context, was very different now in Barbados. Barbados as a country had already identified dengue and early warning systems as a priority for the country. The Ministry of Health was committed. They had already done prior studies to advance their work and their knowledge on climate and health. And so when we came in, we were responding to a demand. It was a demand-driven project.
That must have been a very different experience. Yeah.
Very different experience. Also a totally different context. If Barbados is a small island developing state in the Eastern Caribbean. Mm-hmm. So the population of Barbados was about 240,000 people, was about the same population of the city that we were working in Ecuador.
Right.
So it also, for a whole suite of reasons, made it an ideal place to begin to work to really implement this early warning system. So we were able to partner with the Ministry of Health, with the regional public health authorities and the regional Caribbean Institute for Meteorology and Hydrology, to then adapt the model and the sort of mathematics that had gone and been developed with the modeling framework in Ecuador, but now adapt it to what they needed. And also we did this through a process of co-development. So the partners, again, demand-driven, they said from the beginning, this is what we need. We need a model that's simple. We need a model that can do A, B, and C. And that was incredibly important, that they were there from the beginning of the process, really driving, how the model and the tool was developed. And that work continues today. So we're in the process right now of continuing to work with them to now implement the model and to make it operational.
And also, I guess, having them work so closely, you can also fine-tune it. Once it's being implemented, you can work in real time to sort of mold it to be hyper-specific to this one region.
Yeah, I think, again, this goes to me, the most important lesson of all of this is that you need to have co-creation. You can't have academia and research happening in a vacuum separate and then expect at the end of the day that the technology or scientific breakthroughs will then be automatically applied and used by your, in quotes, end users. We really need to have everyone sitting at the table together, working as equal partners if we want to bring science to have an impact on disease outbreaks.
One attempt to implement the ideas of early warning systems in South America is a project called HARMONIZE. The project works in sites across South America and the Caribbean, building digital tools to help places affected by changing climates. To hear more, we spoke to Rachel Lowe. She's a research professor at the Barcelona Supercomputing Center, as well as being the principal investigator and project coordinator of HARMONIZE. Plus, she's a former colleague of Anna's. Rachel told us about the work HARMONIZE is doing to develop toolkits for predicting disease outbreaks.
HARMONIZE is based on a co-creation approach where we are co-developing tools with and for the local communities. A tool is only useful if it's used, so we want to be sure that it will actually be used and help build resilience after the lifetime of the project. So we're working with entomologists, epidemiologists, data scientists, software engineers, social scientists, as well as community leaders, experts from the Ministry of Health and from meteorological organizations. We are working closely with the communities to understand how climate and environmental change is impacting their environment and the kind of concerns they have about emerging disease risks. We're particularly focusing on diseases transmitted by insects like mosquitoes or sandflies. We're focusing on dengue, chikungunya, Zika, malaria, and leishmaniasis. And we're doing this via a series of interviews in collaboration with the local public health and environmental teams to help build trust and ensure that we can develop digital tools that will essentially help to protect the local communities who are suffering the impacts of climate change on their health. We are developing it using open source softwares, and we're also developing training and capacity building workshops, which will help a diverse group of researchers, data managers, and decision makers understand how they can build their own harmonized data sets from scratch and tailor the toolkits to suit the local requirements. I've always been fascinated by the way that our health is impacted by the health of the planet. And I love the way that we can use data to understand how climate change in the environment is impacting our health. So sometimes we're using climate data that is produced by global climate models, and these grids may have a resolution of around 10 to 100 kilometers squared. And we want to be able to align these data sets with information collected by health authorities, which are often collected at administrative units. So this may be at the district level or municipality level. We are also collecting data to describe local processes on the ground. So we are using drones, and this can help us detect water bodies or the presence of water storage containers next to buildings. It can help us understand changes in the types of trees that are growing and different kind of habitat that are suitable for mosquitoes. And with the weather sensors, we are collecting data on temperature, precipitation, humidity, UV radiation, wind speed and direction. And all this data is then automatically transferred to a platform where it can be downloaded and visualized and combined with the other data sets we're collecting in the project. And it's amazing to learn how the project is perceived by the local partners and the enthusiasm around using this digital technology to try and understand how climate change is impacting the local environment.
So, co-creation, collaboration, open source. What do you make of the HARMONIZE approach?
So I've been collaborating with Rachel for the last 15 years. So
you're into
we're
it.
very familiar. Yeah, this I would think is something, as we've sort of both grown up together in our academic careers. The work that we had done in Barbados and in Ecuador before that was really about the need to co-create and to bring all the different partners together in the process from the beginning. And so this is what's also underpinning the work at HARMONIZE. And I think this ethic, it's really an ethic about how you do research is critical if you want to do research that's impactful and meaningful for different communities. At the same time, thinking about open access, creating tools that are open access is incredibly important. There are challenges there as well because the data sets may be sensitive. Not everybody wants health data, for example, to be open access. Understandably, there are data privacy concerns around that and ensuring people's confidentiality. And at the same time, you want to get information into the hands of citizens and also the different people like the public health sector who need to take action as soon as possible. So I think this is a really important approach to do science in a way that's transformative and impactful.
So once HARMONIZE builds these digital tools, how do you envision governments or other decision makers might use them?
So these sorts of tools ideally would be linked to their national climate change adaptation plans or the national health adaptation plans, where the governments can use this kind of tool as a strategy to respond to the challenges of climate change, specifically in the health sector. The important piece is that you need to get the buy-in from the government at the right levels so that they can then dedicate the people and the resources to carry on, to sustain the use of the tools, and also to bring in the tools into their routine decision-making processes. For example, if the Ministry of Health has a monthly meeting where they're reviewing, regularly reviewing epidemiological information, data on dengue, then you would hope that they can use this tool in that meeting to look at what is the risk for dengue over the next 3 months. And so this part of the implementation of the tool is critical. So my hope is that sort of as you develop the tool, the next step has to be on the focus has to be on the implementation of the tool and how that happens to ensure that it has an impact in people's routine, again, day-to-day decision-making processes, be it at the community level or at different levels of the Ministry of Health, from local to national level. Depends on the context of where it's being applied.
So what are some of the challenges in this field when it comes to translating the research into practical tools that actually get used, which is at the end of the day what we want?
Mm-hmm. Well, one of the issues we already talked about was that a lot of the research happens without true engagement with the users of the tools. And so we've seen this in many different settings where a lot of the research is still driven by researchers sitting in the global north, which tend to have more research dollars, maybe research access to computing facilities, with the hopes that at the end of the day, countries in the global south will use the technology or the models. And it doesn't happen. There's a mismatch. Maybe there's a lack of assessment in terms of the capacities, the local capacities to use and apply such a model or to sustain a model. So that's kind of a failure on the part of how scientific partnerships happen and how science is funded. The other major challenge is around within a country itself, the governance. So between the different ministries that need to come together, for example, the National Institute of Meteorology and Hydrology that provide the climate information, need to come together with the public health sector so that they can bring these different kinds of data sets together in an early warning. There are often major governance barriers and institutional barriers that allow people from the different sectors to sit down together, to share data, to create processes so the data sets can even, what the terminology is interoperable, so the data sets can talk to each other, the same format.
Wow. I didn't even think about that. The gap between research and government, I think, is a gap that makes sense to me. But then when you think about the gaps even within government to share information and to kind of coalesce all of their data together so that it can be usable, that's also quite an obstacle.
I think it's one of the biggest barriers is the institutional frameworks that limit working across the different sectors within a government. And at some point, you have to have a high-level mandate, someone in the government saying, this is really important, and you, Ministry of Health, need to dedicate time and resources and people to work on the climate and health nexus, and the climate sector need to do the same. And you have to invest in those people, train them. You have to have people who are sort of specialized at being bridges in between in these sort of intersectoral spaces, these spaces that require bridging across the different disciplines and sectors. And that's often lacking.
How common is the use of these kinds of early warning systems in public health around the world?
So we did a study for the Wellcome Trust looking at the existing models that were out there to predict infectious disease transmission using climate information. Myself and other colleagues, Sadie Ryan played a major role in this study. She was the lead scientist. Rachel Lowe was also a part of this. And we analyzed over 9,000 scientific studies that have been published through doing a structured search of the literature. We were able to pare that down to really look at a very small group of modeling studies that fit the criteria that we were looking for in terms of a tool, which meant that the code had to be available, had to be somehow open access. And you had to move beyond just doing research to look at the effects of climate on health. In the end, I believe it was less than 40 total potential tools worldwide, which is shocking. And of those, the vast majority were on vector-borne diseases, dengue and malaria. And there were very few on other kinds of infectious diseases transmitted by water, soil, air. So we saw that there was a huge gap in the research that was exploring how climate and health or climate and infectious disease were linked, and then the research that was actually bringing it down to the level of a potential tool. Even of those 35 or so odd potential tools that we found, we think that less than a handful of them may have actually been used in practice by the public health sector. So again, talking about this pipeline of going from research to potential tool development to actual tool use on the ground, there's a huge need to do more focus and investment to make the research come to be implemented and used in tools by the public health sector.
Let's hear more about the efforts made by HARMONIZE to build tools for communities. Franciana Valenci is a research assistant with HARMONIZE. She spoke to us from a site visit in Cametá in Brazil and told us how engaged the local communities are in the project.
So I'm part of HARMONIZE as a research assistant for Fiocruz. I'm in my second year on this project. Basically, since day one, I've been the one connecting with the communities and the folks involved. I get community leaders on board, and I help link up the different communities and anyone else who's interested, whether it's in urban or riverside areas or in remote quilombolas communities. We've been getting a really good reception. Everyone's got a viewpoint on the project, especially when we talk about keeping tabs on our climate. And when we mention how the climate stuff is tied to the tropical diseases we're dealing with, that really gets everyone's attention, you know? They're interested in getting involved and helping out. HARMONIZE brings this tech that's actually focused on the community, which is something you don't see much. So it's got a really good vibe. I think this whole thing about technology helping regular folks is definitely in the public interest, seeing as how tech advances don't always benefit these people. And the municipal leaders have been kind of slow on the uptake in realizing that new tech can really help with monitoring the climate and other factors. But HARMONIZE is different. It brings that tech right to the people. So the community is really embracing HARMONIZE. I think we've seen a big jump in engagement from last year to this year. The community is getting more support and everyone's keen to participate. So, yeah, I definitely think this project has got a bright future.
It's great to hear how closely the team is working with local communities. What kind of insights and impact can these local communities bring to projects like HARMONIZE, and how do they benefit from participating in the research?
Yeah, I think it's critical that the local communities are participating, and often doesn't happen, especially in modeling, this kind of modeling research. I would say often it happens sort of far away from the local communities. So in my experience working in Ecuador, the local communities often have a really good idea about what's already happening in their community. They have an idea about how climate and weather is driving disease outbreaks. And maybe even if they have, if there's misinformation, that's also an important entry point. You know, that's a point to open a discussion. And so having people speak, have their knowledge be valued, and then to have that feed into the process of developing a tool is really critical. I think there's a win-win on the side of developing better tools that are better informed. Usually when I've had the experience of working with local communities, they reveal nuances that a researcher wouldn't know unless you live and are in the community, things that are undergoing that can explain patterns of why you're seeing this or that. And so the researcher has to put themselves in a position of much more humility to listen to community members and to recognize that their knowledge and their experience is valued and valuable. And researcher and the community, on the other hand, I think also gains tremendously if they are able to gain knowledge. And also you hope that, my hope is that sort of young people who are involved and exposed to this sort of project may be then inspired to continue a career pathway or to continue to be engaged in science and in technology. And often in more rural areas outside of major capital cities, young people especially, have less exposure to science and technology.
What's the wider potential here? Can the ideas behind a predictive model used for dengue outbreaks in South America be applied to models that forecast outbreaks of other diseases and in other parts of the world?
Definitely, and that's already happening. You know, the work that we've done with Rachel and her team in Ecuador and in Barbados is now being spread to other countries where they're working the HARMONIZE Project. I know that their team has also worked in different parts of the world on different kinds of diseases. And so the underlying science that's driving the development of the early warning systems is broadly relevant across the world for climate sensitive. We call climate sensitive meaning any disease that is influenced by climate. So any kind of climate sensitive disease outbreak, we can learn a lot from the modeling frameworks that's developed, even the technologies themselves, the code, the code that's written and is then made publicly available is already being taken up and used and adapted for different places around the world. So there's a lot to learn and a lot we can share with each other through an open science approach.
This conversation has been so fascinating. I really loved your ability to not only explain to me how early warning systems works, but also to kind of give me a glimpse into what it might look like in the future once more governments have access to this, especially in communities where these outbreaks are more common. I'm really excited to see where the research and these early warning systems takes us in the future. And I just want to thank you so much for taking the time to talk to me. This was a really informative conversation.
Oh, thank you so much.
Thanks for watching this episode of When Science Finds a Way. Thanks also to my guest, Dr. Anna Stewart Ibarra, and our contributors, Rachel Lowe, Bárbara Priscila dos Santos Corrêa, and Franciana Valente. Okay, I feel like this episode was really about bridging the gap between research and practice. We can make all the detailed predictive models we want, but if they don't translate into effective tools that help us respond to infectious disease outbreaks, then what's the point? That's why Anna's perspective is so valuable. As an international public servant with a background in scientific research, she understands both worlds and how they could work together better. The HARMONIZE Project is an exciting example of how to do this the right way, building useful technology through co-creation and community engagement. When Science Finds a Way is brought to you by Wellcome, a charitable foundation that supports the global scientific community, working to build a healthier future for everyone. If you visit wellcome.org/podcast, that's welcome with 2 L's, you'll find transcripts from the show and a whole host of information about the urgent health challenges Wellcome is tackling. And remember to hit the subscribe button here on YouTube for more episodes of the podcast. All right, see you next time.